Good evening, this is Lyle. It is the 20th of February, lovely Tuesday. I just feeling kind of bummed tonight because I went to have my labs done today, had my doctor's appointment, and the lab was backed up, so I didn't get in quick enough for them to get results at the appointment. And so we were on the way to another appointment for my wife this evening, and we got the call from the doctor's office that shut down my chemo. My white blood cell count had dropped too low. So it's been running around 3.8, which is just fine. 4.8 is normal, 4.8 to 10.8. But 3.8 was acceptable, but this week it dropped to 2. So that's not acceptable. And the other counts were also dropped. Either they're low out of range or high out of range, depending on which way it was supposed to go. So anyway, so much for that idea. So instead of getting chemo tomorrow morning, we'll be doing other appointments for my wife Gisela. Um, First off, before I forget, make sure everyone gets screened for cancer. Colonoscopies or any other type of screening that's available for whatever you think you or have a hereditary, you know, tendency towards or whatever else. Just make sure you get screened because it does save lives. Um, so anyway, instead of doing chemo tomorrow, unfortunately, my wife Gisela had a fainting spell. It'll be 2 weeks ago Thursday, and she fell down and luckily missed everything that was really pointed, like the blanket chest and things like that, side of the wall, the corners of the wall. But she fell back and on her back and hurt her tailbone and hurt her head and neck. So we went to the hospital the next day again. She spent the weekend in the hospital. She ended up with severe aortic, don't tell me, stenosis. There we go. Like I said, I'm just feeling kind of blah right now. Severe aortic stenosis, which is a heart valve. The aortic valve would only open 25% of what it's supposed to. So she's only getting 25% of the blood flow that she's used to, which is why she's been feeling dizzy, especially when standing up from sitting down or from lying down, and then why she passed out. She did almost pass out 2 or 3 more times again, and had a total of about 10 or so episodes that hit her and made her feel nauseous and dizzy and like she was going to pass out, but never did again. Anyway, last Thursday when we did the uh, angiogram, they found that the lower or the left anterior uh, descending artery. Sorry, I'm just not. My brain isn't kicking as well as it should. Left anterior descending artery was 90% blocked. That artery is called the widowmaker, and that's because it is the one of the hardest ones to recover from, because it affects all the heart muscle and everything. So if the heart muscle is dead, the rest of the rest of you ain't gonna last long. But anyway, it's the largest artery that feeds the largest coronary artery, so the largest artery that feeds the heart. And again, it's a very dangerous. It's usually the most deadly of all heart attacks is one caused by that. Luckily, she did not have that. Luckily, they found it, were able to blast it, balloon it, and stent it. So she's got back to her blood flow she should have. We went yesterday for a CAT scan so that she could get measured for the heart valves, because they manufacture heart valves to order so that they fit correctly. And they have to, if they are too tight, they don't open properly. If they're too loose, they leak. So you don't want either one of those scenarios. So in addition to that, she had to do a dental x-ray exam, because anything in your mouth that gets infected when you have any type of procedure, major surgery or heart issues especially. I had to have one for stuff that I've been doing. Anyway, for anything that's major like that, they need a dental scan, because if you have any infection in your mouth, it can travel to anything in your body quickly. So you have to be very careful. So anyway, she had the dental exam, and it came back with a place that they couldn't tell for sure whether it's good or not. So we were able to, that was yesterday, the 19th. We were able to get into the dentist that they recommended, which is right there in the same area that our cardiologist is in Munster, Indiana, and or the cardiology team is part of it there. Anyway, um, so we went tonight. They had a 5:30 appointment. We got there way early. We wanted to count for traffic just to make sure we got it, because this clearance is pivotal to getting the surgery scheduled. So without that, we can't schedule surgery. And we have an appointment tomorrow at 3 with the cardiac surgery team, and they're going to assess everything, and then from there, hopefully schedule. So anyway, we got there. Everything was good. She went back, got the x-rays done. They went to do the three-dimensional CT scan that they do of the inside of the mouth and the places they can't get to or can't see with any other way. And the darn thing wouldn't work. They tried calling IT. IT said they can't get it up tonight, but hopefully they'll have it tomorrow. So our plan is, since we have to go right there anyway tomorrow to Munster, it's almost an hour away. It depends on traffic. It could be anywhere from 45 minutes to 50 minutes, normally, to an hour and 15 or 20, depending on traffic. So anyway, tomorrow, on our way, hopefully they'll have the software fixed again, and we'll be able to get the scan. It only takes 15 minutes to run in and do that and run back out. And he looked at everything else on the x-rays, looked at all our teeth, and said everything looks fine. He said he was like 99% plus sure that there shouldn't be a problem, but without that he can't sign off. He has to have that in hand, because it is such a delicate issue that, you know, if it's wrong, you're in bad shape. So anyway, we'll be doing that tomorrow, getting the CAT scan hopefully of the head area and the back of the neck and the teeth. She does have one wisdom tooth that has never came through the skin. It's back there, so they want to make sure that one's okay. And then we'll do the surgery thing, and I'll just be sitting out and chilling for another week. I'll get a call tomorrow from my doctor, the hematology oncologist office, and they'll schedule the next set of labs, which they said they're going to try to do it a week from now, and then schedule the next chemo. And as long as the labs are good, we'll be able to do the chemo. So hopefully it'll come back up into the 3 range. I don't like being immunocompromised that bad. So anyway, everything else, you know, just kind of blah still. And I have energy in the mornings, but by evenings I'm pretty well shot. Everything else is halfway okay. Had some issues with a little pain in stools and things like that, but nothing major for the last few days. Up through Saturday, though, of last week, or Friday of last week, I was dealing with constipation issues from the last treatment. So anyway, that's where we are today. The focus for this week is off of me and onto my wife, Gisela, and hopefully we'll be able to get that surgery scheduled, because even though they got the 90% blockage cleared in the widowmaker, the LAD artery, so it's still 25% blood flow is not good to the brain. She could fall at any time and, you know, pass out or fall and get hurt bad. So they were pushing to get it done within 2 weeks, and it's just been it'll be 2 weeks Sunday that they actually diagnosed it. So hopefully we'll have a surgery time for next week. Anyway, that's it for the evening. Have a great evening and a great rest of the week. Thanks. Bye.